Good afternoon, I'm Gene Paranek, host of MedTech Crossroads. We are here at the MedHealth Summit at Ford Field in Detroit, Michigan, and I'm joined today by Molly McCarthy, who is the U.S. industry leader for health providers and plans with Microsoft. And you were good enough to come out here and talk at the summit. Your panel charting a new patient experience through innovative bedside care. We're just grateful to have you here today at the event and talking to us right now.
Well, thank you. It's great to be here. I have a passion for the health and tech world, so thank you for having me.
Yeah, I can tell. I was looking at your CV or whatever you call these things, and looking back, and way back in the day, a neonatal intensive care nurse and pediatric nurse.
Yeah.
This is where you got your start.
I started a long time ago in neonatal intensive care, NICU, and pediatrics. So always, even back then, really had that patient-centric, family-centric approach to care because you had to. It wasn't just the baby or the child that you were caring for. It was really the entire family. And that's where I started my career. And just to be honest, had a real curiosity with technology and. Many years later, here I am.
It's really neat, Molly, because I looked one line up from there,
Right.
And I realized, and then the next thing you were doing right after that was you were teaching other people. So you've got this sense of a vision of, I know what's needed, and now I want to communicate it. I want to see that plan come out, which, my goodness, now I look at what you're doing today with Microsoft and health providers and plans. You're thinking about how this should all go together.
Yeah, no, I worked clinically, and I also taught undergrads, and I still do. I lecture today.
Oh, cool.
It's just important for me that they have exposure to what's out there beyond maybe what they're learning in the classroom. And my passion's really been around thinking about how technology can really unite clinicians and patients so that they can better patient outcomes. And I'm going to talk about the quintuple aim, which started as the triple aim, which was better health outcomes, better patient experience, and lower cost of care. And it's morphed. It's added two other areas. One is, especially today, so important, the clinician experience, thinking about healthcare workforce burnout. And then the fifth really kind of goes across all the different facets of healthcare. It's just health equity. And that was really brought to, I would say, the public's attention through COVID-19. But really, it's always been a component of healthcare that we really need to think about, not just what happens in the hospital, but truly what happens and what is available to the community in terms of, just even Wi-Fi access, thinking about their community, thinking about where they live, their zip code. So important in healthcare.
That's a big topic of the conference today, is some of these sort of community factors and public health data. Not so much to say what's your data, but to look at what are the trends that we see on a community basis based on zip code and other things like that, which is really, really powerful. You mentioned number 4, the clinician experience.
Right.
There was another term that I've heard a couple times today, which is practicing to the top of your license. Describe that for me.
Yeah, so I think, everyone who provides care typically has some type of registered nurse license, medical doctor, and really thinking about how, from my vantage point, technology can help, maybe in the background, help clinicians practice to the top of their license so that they're not having to spend time, for example, as much time documenting. Perhaps they can do it through dictation. Ambient clinical intelligence, is there an ability to bring in sound through microphones and screens into a room to help with what's going on in the environment, both from a patient perspective, but also from a patient caregiver safety perspective. And so really thinking about the way that technology can help our clinicians put them back at the bedside where they're doing, either procedures or discharge teaching, medication administration. So, for example, with the complex chemotherapy patient, really focusing on that patient and what that patient and family needs rather than administrative burdens.
They shouldn't be there just filling in paperwork the entire time.
Right.
They should be doing what they're there to do, which is take care of people.
Right.
So when I think of Microsoft, I think of a company that has established itself as being really an ecosystem player. I think one of the many strengths there that, somebody who works in an office, it's like
Right.
this can become sort of a standard and these things work together and they all go together. I think for a lot of people, maybe Microsoft isn't the first company they think of when it's like, oh, I'm going to talk about healthcare. But of course, we all know that Microsoft is deeply involved in that. Tell us, I guess, a little bit about how Microsoft thinks about the healthcare industry, what it's trying to accomplish there.
Sure. So, I've been at Microsoft for almost 10 years, and technology has dramatically changed over the past 10 years. But when I think about even as a bedside nurse, the technology to me was perhaps the medical device. I actually come from a patient monitoring background, so the actual device that was recording vital signs, et cetera. But really, if you think about what's inside that technology and what's aggregating the data, and today funneling that data into, for example, the EMR, and then what is we have these massive amounts of data now. And so how are we using that to improve patient care, improve our practice, as well as provide that data back to the clinician in a manner they can ingest it so that they can make readily, decisions at the bedside, whether that's through prediction or whether that's just retrospective. We like to think we're being more proactive. So with Microsoft, we really have focused on three areas within healthcare. We're a big tech company. We're not a health IT company, and I always try and really make that distinction. And we partner with so many different health IT companies that really take the solution the full mile. So if you think about it, I'm just going to make an analogy. Like I tell people, we are the circulatory system, we are the skeleton, we are the infrastructure. Whereas we partner, for example, with Teladoc today. We talk with them, and they really bring it all together in a seamless manner that's presentable, to the end user. So we're on the insides, and you don't hear a lot about what we do, but back to the three areas, it's really thinking about cloud computing, so Azure, Dynamics, which is really around, customer relationship management, and you think, well, why would we need that for healthcare? And you do. You need that, especially as we think about the patient experience and preferences, for example. And then the third piece really is around communication and collaboration. So, for example, Teams. And so those are the three components at Microsoft that we've brought together in the Microsoft Cloud for Healthcare that has specific features that are important to the healthcare industry. So, for example, and this goes across all Microsoft, but trust, security, compliance, privacy, really important in healthcare, as well as FHIR standards, APIs, HL7, and making data interoperable so that you don't have information in silos. And ultimately, you want that, as I mentioned, you want that data to be interoperable so that you can present it in a way that that clinician can make decisions, or the patient can make decisions about their own health.
Yeah, so it's available and understandable. You talked about sort of the communication aspect of understanding what we have there, and I analogize it back to the world that I work in, which is medical devices, and usability is a gigantic thing. And FDA will say, well, is it usable? And the company goes, yeah, it's usable, and it's like, well, is it really usable? And of course, we're all familiar with Microsoft products, and that's a part, I think, of the company's nature. You mentioned interoperability too, though, and to me that brings up a whole in my world, this niche of, you go out and you say, I've got a device here, and this device is interoperable with these other ones, and the FDA goes, really?
Right.
But tell us from the standpoint of interoperability, it's no small challenge, but how do you approach interoperability? How do you think about that? The bigger your domain, we were talking today about community health and population health, and it's one thing to have like one doctor or one healthcare system or whatever else, but now you start to expand that out. How do you think about interoperability?
So I'm going to give two parts to two answers to your question, so keep me on track. The first part is just how I've seen technology evolve. So I transitioned from clinical practice into medical device. So I started when you would have a medical device at the bedside. You would, for example, it may be a diagnostic device or a screening device. You'd test the patient. Even patient monitors, you'd print out the result and you tape it in the chart. That's where I started. And so over time, obviously, we've become a much more connected system within the hospital I'm talking about right now. And so the interop really comes into play when you walk into, for example, an intensive care unit, like into a room, and you see 12 different devices. And ensuring that that data is all funneling into, for example, the electronic medical record, just from a record to have that record, but then also, as I mentioned before, thinking about aggregating it so that the clinician can make a decision and have that data in front of them in a, like I said, ingestible manner. Yeah. So that's one piece. The second piece about interop is, I would say more so today, not as a caregiver in the hospital, but like as a consumer. If you think about it, I always like to give the analogy of cashing a check or my bank. I can get a check from anyone, anywhere in the world, or I could even have it transferred electronically to my bank. And it doesn't matter what that person's bank is, where it comes from. I mean, it does matter, but it
could even be a different currency, though.
Right.
Yeah.
And it can be routed into your bank, and you know that it's done securely. I can pull it up on my app, and I can look at it. Whereas with patient records, the challenge from a consumer perspective is, I might have a primary care physician, I might have gone to an urgent care, I might have an MRI done every year at an outpatient clinic, and so I have data in multiple different areas. So as the consumer and being in healthcare, it's incumbent upon me to, I know where each portal that I have, for example, ideally I would love to see it come in and funnel in, for example, like financial data into one space so I can see it all collectively. And honestly, as a caregiver or a clinician, I want that too, because I want the complete picture, especially now that we're thinking about patient-generated data, and that's a whole other episode. So I don't want to go there today.
Yeah, fair enough.
I am very into data. I actually wear 2 different devices. But just the massive amounts of data today, I think that's kind of the next frontier and how we utilize that for the greater good.
It's funny how one little paradigm can sort of switch your mind. And when you said the financial industry or banking,
right,
as I think I alluded to earlier, I hear people talk about data portability, and they're like, well, you need a briefcase that you could take your data from one institution to another. And okay, fine, I'm listening. But when you said bank, it's like, wow, that actually is probably it's the first time I've heard it, actually. It's probably a better analogy for the kind of thing that we're trying to do. And in an industry that they have succeeded at making it that transparent. So possibly a much, much better model there.
Yeah, and it's comparable if you think about it, because money and health and wealth, I mean, those are probably 2 of the most important things to a person. And so I would love to, as I push forward within the health and the IT industry, to see that come into fruition. I personally, I want all my data in one place.
Yeah, very much. I feel the same way.
Yeah.
That's awesome. Well, Molly, we're so excited to have you here today, here in Detroit and here at the MedHealth Summit, and talking to us now. Any thoughts you want to leave us with as we go?
No, I think that I was reading earlier today, and I'm sure listeners have heard this, but, we're in the 4th industrial revolution. And I think, while the healthcare system, both providers, payers, life sciences, med devices, I think the cross-pollination that we're seeing and the disruption, even from retail, we do a lot of work with, for example, CVS Health. It's going to be, and it is a really good thing, not only for our clinicians, but for our consumers. And for me, that's why I get up every day, because at the end of the day, I want to know that the clinicians have access to information that can help them do a better job. And as well as patients, I want to ensure that they know what's going on with themselves and their families.
Yeah, well, it does seem very much like we're living in a time right now where a lot of things have changed over the last few years, and there's really some opportunities that are really cool because people have woken up and are paying attention to a lot of things now.
Right. Well, thank
Molly
you.
McCarthy, Microsoft, thank you so much for being here.
Thanks.